Good evening, moms and dads. First off, I'm Dr. Michelle Dougherty.
And I'm Dr. Carrie Voigts.
And this is Bumps and Bundles. And we are excited just to be chatting with you all. Maybe you're getting ready to go into a feeding. Maybe you're counting down the days before you get to welcome your little one home. But we just wanted to be able to reach out and connect with you all because we understand the real work happens when baby arrives. So what can you expect? What are some things to look out for? So we're just gonna hop right to it.
Dive right in. So let us share our screen.
Yeah, we'll just go there.
Okay, we got there at the beginning, so we are good.
Okay, so as we said, this is Bumps and Bundles, and we work with a lot of providers in the community. We know that it takes a village, absolutely, to raise a child and nurture a mom and a family. So we are happy to share what we know and just to let you know that you have another resource in us. First off, when we think about health, most of us just think about feeling good, and that's a part of it. But what I want you to think about as well is it's not just the absence of disease or symptoms, it is the big picture, the whole package, the physical, mental, social well-being. And if there's any time than the present, this is so important. And it's important to surround yourself with people that are going to help you get to where you want to go. So when we work with our pregnant mamas, our new mamas, our babies, these are going to be the top 5, and we're going to get into like the bonus 6th. But of course, nutrition throughout your entire pregnancy, depending on if you're taking a class, they go into things like protein and water because your blood volume is tripling. And water, especially when you are nursing or pumping, is huge because it's just this revolving loop and you need to stay hydrated. Exercise, obviously during pregnancy, it's important. You don't want to start anything new, but especially once you have baby, it's important to get clearance from your OB or midwife, and that's usually around 6 weeks after a vaginal birth or 8 weeks after a cesarean. But then you want to start slow, and eventually you will get back to where you were at one point. Sleep, there is one thing that I did not enjoy hearing before having a baby, and it was get the sleep now because you're not going to get it later. And it's hard to hear that after you're already sleep deprived and maybe you are a new parent, but sleep is going to be important. If you can, sleep when the baby sleeps. You've heard some of these things before. Get someone to help you out. You need your rest. But when you are welcoming a new bundle of joy, it's kind of incredible how you can go so many hours without sleep, but when you have this magnificent miracle in front of you, you know, it goes away. Your body just finds a way. But one of the most important things is your mindset. So again, if you are a brand new parent, you just brought your bundle home, you want to know that you feel supported and that you got this, because you really do. And you want to be able to trust your instincts and not feel like you can't do it, because you absolutely can. And if you haven't had your baby yet, you want to make sure that if you are going to have people where you are giving birth, that you're only allowing people that lift you up and support you to be there for you.
All right, so if you've heard about chiropractic and pregnancy at all, you've probably heard of the Webster Technique. So this is a specialized technique that chiropractors use on pregnant women, which basically is designed to balance the pelvis. So anatomy-wise, uterus sits in your pelvis and it is attached to your sacrum or your tailbone and your lower back in a couple of different areas. So this technique is designed to help balance or align those bony structures. So therefore, it will open up that uterus, and that does a few different things. So one, it helps baby have the most room to grow and develop. And second, it's allowing baby to move head down when they're ready and make that kind of a smoother transition. So with chiropractic and pregnancy, there's benefits for mom and benefits for the baby. So like I said, we're aligning that pelvis and removing that tension in that pelvis to open it up. And also we're chiropractors, so we're adjusting and helping remove that interference from the nervous system. So we're allowing that nervous system to function and connect with those essential parts of your body. And then it's also been shown to help make for an easier, safer birth with less interventions when you're going to a chiropractor, because everything is set and ready for that important day. Benefits for the child, again, we're removing interference so the baby has less interference, more room to grow and develop, better birth positioning, and decreases stress during labor and delivery. And then also, this is something that we hear from our mamas too, like when they're coming in while they're pregnant, they tend to have less aches and pains, more energy, they're able to sleep better. And again, going to the chiropractor has been shown to decrease that labor time, decrease that labor pain and effort. So who wouldn't want that?
Mm-hmm.
And then just overall picture, chiropractic, we're helping your body work better. So remove that nerve interference, it can function better and help that labor continue naturally.
So stress, no one's immune to this, especially over the past few months, but stress is such an important piece in the whole puzzle with what happens on the other side. So cortisol, known as your stress hormone, it's important to know how that all factors in with your growing baby. So in trimesters 1 and 2, your baby is actually feeding off of your stress hormones, mom. And by the 3rd trimester, baby is making their own. And that's important because if you have stressful events, it can affect how future growth and development occurs. And this pandemic that we're all trying to rise above has caused a lot of stress. And not only are babies being affected in utero, a lot of them are starting behind the 8 ball, again, before they even entered this world. So it's not just us as moms. As we know, yes, it can affect our milk supply and things like that, but it can actually affect how we go into labor. The first 1,000 days, that is the time frame between conception through the 2nd year of life. So it's amazing when you look at these, it's like these windows, critical windows of opportunity and neurodevelopment. We are developing these primitive reflexes, and eventually that helps your brain mature so that you can go through the different phases of life and development, but it really is laying the foundation for your child's physical and mental well-being and health moving forward. And as Dr. Carrie was talking about, just the importance of that nervous system working on all cylinders at all times, that's why it is the best time to get adjusted while you're pregnant, and especially immediately postpartum for you and baby, because it's shown to have so many positive benefits physically and mentally for you and your child. When you have stress stuck on your nervous system, which is how we live all of our lives through, stress will deprive baby's body, of course, for different things like nutrients. It's going to affect things like growth and development and sleep and hitting those milestones, especially the motor development, because we're so focused on movement, and that's how we live. That's how our brain matures, is through movement. So you want to make sure everything is moving properly and we have the least amount of stress possible.
So Dr. Michelle talks about stress on the nervous system. The really cool thing here at LHW is we have technology to show where that stress is on your nervous system, whether you are, 8 months pregnant, 8 days out of, getting an earthside. We can measure that stress on your nervous system and see how your body is functioning. So we have a couple examples. This first one is a woman that's 38 weeks pregnant. The scans on your left are showing her when she just came in. The scans on the right is a post-scan after baby, or after some visits and care with chiropractic. So we can see on the top left, the green and that purpley color is signifying stress on that nervous system. The top right after some care, we can see things have calmed down with no more purple, less of that green, and that yellow is kind of that ideal. The bottom scans are muscle scans, so showing tension on that in the muscles. So bottom left is pre. Red is a lot more tension on those muscles. So we can see on the right scan, the red has calmed down. So we're not expecting that to completely get back to normal, because after baby, your body is still adapting and changing to those changes, basically. So we can see it's more balanced from side to side. We don't have those huge spikes right or left, but there's still tension in those muscles, because once you have baby, you have all those other different new positions you're in, while you're feeding baby, might not be sleeping as well. That's just, stress and tension in your body. So this next scan is on a 6-week-old baby girl. Again, these scans are completely safe for newborns up to great grandparents. So the scan on the left is when they first came into the office. There is a lot of tension on that nervous system right now. So a lot of stress, very up top in the neck and down low. So we tend to see this in babies because whether you do a natural birth vaginally or a C-section, it's stress on you and baby. Even in a natural delivery, that doctor is usually pulling on that neck, which stretches and puts stress on that nervous system. So we see that up in the neck. And then lower back, that's going to be a lot of digestion type issues there, which we can see with certain diaper changing techniques, which we'll go over later. And with those different techniques, it can put more stress on that neurology. The next scan on the right, we can see a lot of calming down to that nervous system. Still some issues that we were working with at that point, but what a difference between the first and the second scan. So this scan is on one of our younger kids. He was about 3 when he started here?
Almost 3 when he started.
Almost 3. So this is just kind of showing when you have symptoms when they're infants and the symptoms kind of go away without care, it can kind of evolve to something else down the road because your nervous system is always trying to adapt. So he had issues when he was a little baby. And when he came in around this time, about 3 years old, he was having a lot of kind of mood regulation issues, lots of tantrums outside the norm of what a 3-year-old should be having. So again, that scan on the left is when they first came in, a lot of tension, stress on that nervous system. That post scan, just 3 months later, what a difference, like so much more calm. And like this mama said here, like he still had some issues. I mean, he is a 2-3-year-old, so they're going to have little meltdowns, but kind of back, what you would more expect with a little. So action steps you can take. The first is to decrease what we call the 3 T's. So the 3 T's are thoughts, traumas, and toxins. So think of physical stresses on your body, whether that's the labor and delivery process, whether that's your new normal of breastfeeding baby, the baby being in a car seat and changing techniques, decreasing those physical stresses. Chemical stresses is basically anything you put into or onto your body. If it's not natural, think of medications, foods with a lot of preservatives. It's going to cause inflammation through your body. It's going to be harder for your body to kind of excrete that kind of stuff. So it's going to cause more stress on that nervous system. Last one is the thoughts. So the emotional stress. Goes without saying, all of us are stressed out right now. And if you're pregnant, just have a baby, that just compounds it. So with emotional stress, one, you have muscles that tense up, which can cause, stress on that nervous system. But also your hormones are going to be changing with that stress. You might not sleep as well. You might not make the best eating choices. So trying to decrease all of that is going to help your body and baby's body even better. So decreasing those 3 things increases your ability to adapt to life stresses, those, curveball life throws at you. And then third, find out if we can help. We don't say we can help everybody, but we can do that scan on that nervous system, see if there's stress stuck on, and help you remove that if there is.
All right, so once baby finally arrives and you make it home and you don't have the nurses right there with you and of course monitoring you all the time, we have to turn inward a little bit and focus on you as new parents. How are you coping? That is something that's not often talked about. And by far the first 2 weeks are going to be the toughest. Your body just got done doing something really incredible. And now it's got to shift gears and be, solely focused on this new being. So sleep usually is going to be taxed quite a bit. Our energy, depending on what state of stress you were in before you conceived, that a lot of times can play a role with how quickly we may be able to bounce back, after pregnancy. So we may see some shifts in mood and things like that. Relationships, hopefully you have the support of a significant other or close by family members. No matter what, we do need a support system, a tribe. And we love being part of our practice members' tribes because it really takes more than one. Self-care, as our little graphic says, it's not selfish at all. Just like it's impossible to spoil a newborn, especially during the 4th trimester, when it comes to taking care of ourselves, as you've heard anytime you've ever been on a plane, you got to put your oxygen mask on first before you can help anyone else. And it's so true, especially when you are coming home with this bundle. And with that, we have our going on to the next. As I mentioned just a moment ago about how important your state of health is before you conceive, that can play a role with risks of postpartum depression. But if you have a lot of prenatal stress, especially in those later trimesters, it really sets the stage for things. And as we said, you and baby are sharing stress hormones for most of the pregnancy. And then once baby leaves, you're kind of left, empty, depleted, so to speak. So you need to fill that cup up. You may have what's considered a more difficult baby. You may have more difficulty bonding, and it could go beyond just the latching, which we know that's a whole nother realm of stress for many moms. So it is important to be able to feel like you're connected with your little one.
So talking a little bit about difficult babies. So there's reasons babies cry, of course, like there have to be. Either, they're sleepy or they're tired. You're going to kind of figure out those different cries that your baby makes, especially that hangry cry. But there's other reasons babies cry too. Again, that's the way they communicate. So if something doesn't feel right to the baby, they're going to be more fussy. Okay, so whether that's pain, like a position type thing, or if things aren't functioning well. Let's talk a little about, we call these soft signs. So it's not like baby can be like, oh, hey, mom, like I'm having issues doing this. There's going to be things that you can look for in your baby to know that something might not quite be right. So we like to say that babies should be kind of like floppy burritos. We don't want them kind of stiff and rigid. So if they're arching, if they seem to have they're really strong, they can hold their neck up at, a week old. That's not normal. That's not something that we want to see with babies. So head tilt or not being able to equally turn from side to side, or if they prefer nursing from one breast to another, that could indicate that, hey, it doesn't feel good to turn to this side. There might be a subluxation or an issue in that upper part of the neck. If they don't like to be in certain positions, if they hate tummy time or laying on their back, or if you lay them down and they try to turn right away, that's not a favorable thing. And then also if you start to see a flat spot on a certain part of the back of their head, that can cause issues. It's not just a cosmetic thing, that can cause some neurological changes too. So those are certain things that we tell our mamas to look for to indicate there might be something kind of underlying going on.
So when we have things like the pandemic, or we have more of a fear-based pregnancy or interventions, and then we start to see this thing cycle through poor sleep and we have a colicky baby, you could have any one of these things on the list. And what happens is, as Dr. Carrie mentioned, they don't just grow out of things, they tend to migrate and grow into something else. So here we're thinking, finally, this is done, but now it's like this next level of stress that you don't know what to do and how to handle it. So we start to see labels getting put on our children, and it's happening at an earlier age. So when we are meeting with new parents for their kids, we are looking at the birth history, we're looking at the prenatal period. You have to put pieces of the puzzle together. And this is why being in a state of fear, in a state of stress, it backfires. It starts to make long-term results for our future generation. So chiropractic, just in short, really what it does, it just enhances your body's ability to adapt. We live our whole lives through our nervous system, and what it does is it perceives everything going on in your environment through your senses, and then it's got to organize all that information and coordinate it so we have a proper response or output or behavior that comes as a result. And what we hand out to every single one of our practice members, we have this nerve chart over here, and what it does, it correlates different functions of the body, and it correlates with different parts of the spine and what possible symptoms are if we have stress stuck on there. And then also our nervous system really operates in two modes: fight or flight stress mode or rest and calming mode. So we have the sympathetic and the parasympathetic, and you can't be in growth and in protection at the same time. So when one system is on, the other one is off, and vice versa. When we see a lot of fight or flight or freeze kind of response, these are going to be the babies that either maybe they don't sleep at all during the day, maybe they're fine at night, but they will take no more than a 10 or 20-minute cat nap during the day. Or maybe they're just not pooping regularly, or eat, sleep, poop, right? That's all they should be doing. And that's more in the calming mode of the nervous system. So sometimes they need that calming part activated, and that's what we can do with chiropractic care.
All right, we are going to switch modes a little bit. So normally when we do this presentation, it's in person, so we do demos. But this one, we're gonna kind of explain a little bit. Bonus content you guys will get later tomorrow morning are going to be a few videos of some tips with certain things. So the first video you're going to get is this one. So for most people, they know the diaper changing technique of like the double leg lift, right? So you're kind of flexing those legs up, you're wiping, all that good stuff. So while effective, it's not the best ergonomically for baby, because that constant kind of lifting of the feet is going to cause a bend in that lower part of the back, the opposite way that that curve should develop. So that's put stress on that part of the spine and then on that nervous system. The nerves that run in that area are feeding the digestive system. So we can see more instances of constipation, of reflux, things like that in babies with that double leg lift technique. So the roll technique is something that we're going to send to you guys, basically turning or rolling that baby onto the side as kind of as one, and then wiping that way, and then turning and rolling over to the other side and wiping is better ergonomically for that baby and takes that stress off that nervous system. You can do this up to about 6 or 9 months, because then at that point, like the curve is starting to develop more and it's not quite as stressful on baby. And plus they get a lot more wiggly at that age. So you just do what you can.
Okay, I know it's a little hard to read, but this will be another piece of bonus content. We talk about poop a lot in our office, and we get a lot of questions because this color wheel kind of illustrates it. So this is whether you're formula fed or breastfed. But aside from the colors, the one thing that we really want to make clear that is it is never normal to not poop for a week. It doesn't matter if you're breastfed, because the rule of thumb is if you're a breastfed baby, they're going to use all those nutrients. There's not really a lot of waste. So it's one thing if you're skipping a day or two max when you're still in this nursing young phase, but you should never be going days, because then we know something is up with the plumbing. And as we mentioned, the parasympathetic nervous system is responsible for rest, digestion, growth, healing, immune, all of that stuff. So if we're not pooping, your body is probably stuck in a stress mode, and we have to help eliminate that stress.
This is another video that we're going to send you guys as a bonus. So most people, car seat carrying, they kind of hook it under the elbow, right? Which makes you kind of lean. It's not comfortable. So ideally, the way to carry that car seat is kind of reaching through the handle, gripping kind of that joint of the car seat and lifting it that way. And if the car seat's on the floor, you're kind of going down into that lunge position, so you can use your legs to stand up and lift as opposed to your back, because that'll cause just so many more issues. And again, we're going to send you this video that'll make it a lot easier to understand.
All right. So there's a lot of options when it comes to proper feeding ergonomics. You guys are probably aware of like the boppy pillow, or I think it's called the My Breast Friend, but basically it's elevating your baby to you, so you're not hunching over and adapting yourself to these funky positions. But similar to ergonomics, like if you're working from home, or doing long distance working, you have to adapt your workstation for you instead of the other way around. So there are a lot of different ways. You can use a pillow. You want to keep your back straight. You want your neck to be relaxed. Some people will lay on their side. So there are a lot of different ways, and we have access to lactation consultants there. They know a lot of other tips and tricks. From our lens here, we are looking for a state of neutral balance. So you're not putting additional stresses and strain on the neck and shoulders, because you're already going to be looking down at baby. We're going to be developing new stress patterns between the shoulder blades as you're nursing. So we want to minimize some of that.
So we do get questions here about Bumbo Seats and those sort of carriers. So basically, if you have one, we would suggest not using it. With this, it makes your baby look, oh, they're so strong, they're sitting up, they're doing like these great things. But with this type of seat, they're kind of molded in. Usually the back is rounded. You're putting them in there before they're ready for it. The baby is supposed to go through different stages of development. The best thing for a baby to be in the beginning is on that belly, because they have to lift their head up and turn from side to side. That's going to help develop that curve in the neck and also that curve in the low back. So if they're stuck in a Bumbo seat, that's not going to help anything, really. It's just going to help. It's going to compress them more. I mean, if you sit kind of like rounded, digestion is going to be worse. Lung capacity is going to be worse. And it's not comfortable. It doesn't help those milestones to develop anything like that faster. If anything, it can kind of, go the opposite way. So being on a playmat or Babywearing is much more preferable to these container type seatings.
Yeah, so there are options, playmats, Babywearing especially. This will also give you an extra hand around the house as you're trying to just live life and do things like laundry. But there is a mnemonic called TICS. So tight in view at all times, close enough to kiss, keeping the chin off the chest, and a supported back for baby. And there's a great organization called Babywearing International. They have a great website. They'll have regional meetings where you can actually like rent these different baby carriers, from the ring sling to the ergo, all of those different types of things. But ultimately, you got to pick something that you're going to be comfortable in and what baby's comfortable in. And sometimes we'll see babies facing outward, and you don't want that in the beginning because they're going to be overstimulated. Their senses will be overstimulated. They just need to be close to mom, especially that first trimester out, the fourth trimester. And as they continue to move and grow and develop, then you may want to consider an outward facing.
All right, so when we email you tomorrow, this will be the third video. So this is just a great soothing technique for baby. It helps also with digestion. So if they're a little gassy and constipated that way, it's called the I love you technique, because when baby is laying down, you're gonna start on their right side, so your left, and kind of stroke up from basically kind of the hip bone up to their ribs. And then you're gonna kind of make an L shape across those ribs and then you're going to kind of come down to do the U shape overall. So just kind of that clockwise motion on the belly mimics that digestive pattern. It feels good, and it also helps keep things moving.
So if you are currently pregnant, it's important to have great ergonomics as you go to lay down or come back up, as you want to minimize the amount of separation, which we'll get to in a moment as far as the abdominal muscles go. So you're almost just side lying, and I almost tried to demonstrate that on you there, but side lying and then going onto your back, so you can minimize that. So then the question is, well, what if my baby, like if you're not co-sleeping in and you've got the baby in the crib or in a bassinet next to you, and then you hear them like shrieking, crying, what do? We kind of get up in this motion, and that crunching is going to wreak havoc again on this healing tissue along the midline. So again, you want to retrain yourself to basically like roll to the side right away and then come up to a seated position. So this is something that is going to prepare you. So again, whether you're pregnant or if you just had baby.
So along those lines, we can check for diastasis recti. So basically that separation of the ab muscles. It's something that we check here at the office, and we also have resources of women that teach how to basically heal this, because you can heal it naturally through exercise and just good ergonomics. But basically, when you have this diastasis, there's certain things that you should not be doing for exercises, and basically probably stuff that you're doing that you've done for years. So crunches, burpees, planks, mountain climbers, push-ups, all those lovely exercises we love to do are a no-go, because when you're in those positions, gravity is basically having your organs kind of push against that separation, which makes them separate further. So those, when you're going through this healing process, are different things that you want to avoid doing.
All of this is such sound advice, and when we look at what early intervention is, we know that it's important to get our teeth checked, our eyes checked, and we go to the pediatrician, but rarely, if at any point, is our nervous system getting checked, especially in the beginning stages when there's huge growth happening in those first 2 years of life. So obviously our philosophy is to get the nervous system balanced, but we need to check. We don't want to guess, so we test for it. And chiropractic care, especially when it comes to the littles, it is like night and day between parents and their kids when they're getting adjusted. So this is where most of our continuing education has gone, is to become the experts in pediatric chiropractic. And it is very gentle. Less is more. The assessment takes a lot more time than the adjustment itself. We're asked, well, you know, what exactly are you doing, and is it going to hurt my baby? And the answer is no, it should never hurt your baby. And just to give you an idea of the amount of pressure, we're talking about ounces of pressure. So whether you're testing the ripeness of a tomato, or you have your finger against a stick of butter and just waiting for that just to kind of gently melt in, that's what we're doing. It's more of a sustained hold. We do have some instrument adjusting as well. So we have a lot of tools to be able to accommodate a growing child. And early intervention, when it comes to having a balanced nervous system, what you can expect is better connection with your kid. That's what we all want. We want to feel connected. We want them happy and healthy. And gut health, we know that about 70% of the immune system is in the gut. So when we're activating that calming side of the nervous system, we're activating the vagus nerve that travels all the way down into the belly. So if we're seeing things like reflux and colic and constipation, we have a lot more information on a webinar we just did not too long ago that you can check out that goes into that stuff a little bit further. But then you're fostering a healthy sensory motor development. Again, when the brain is able to effectively communicate with other parts of the body, things have no choice but to work better. So that's what we're the best at doing, and we want to be able to help you in your journey in parenthood. So finally, as we mentioned before, we have a lot of resources. We are fortunate to be able to work with some amazing people, from doulas to postpartum exercise instructors. It's amazing. It really is a neat little community. And we, at the end of last year, we did a lot of one-on-one interviews so the community could just learn a little bit more about what these amazing people do and how we all work together. So I would encourage you, if you have any questions about any of these things in particular, shoot us a message, check out our Facebook page. You'll find some of those resources in there. But ultimately, we just want you to feel like you can navigate parenthood and you do have this. I don't know if you wanted to mention a couple extra things before we sign off here.
I think we just covered all of it. So if you guys have any other questions for anything we talked about in particular, please just shoot us a Facebook message, give us a call. We're always available to answer questions and help you become more confident and comfortable with what lies ahead.
Thanks, guys. Take care.
Thank you.